Health experts say despite measures to reduce the spread of the virus, they do expect the number of cases to just keep on increasing.
Yeah, it's not only doctors and large healthcare systems dealing with the threat of COVID-19, so are the independent physicians and clinics.
That's right. Blake Lipton found out how they're preparing.
I know that whoever your doctor is, they do not want you walking in and then telling the nurse in triage, hey, I think I've got COVID-19. A phone call, I think, is not only courteous, but probably absolutely necessary.
Dr. Kenneth Hoplin with Medical Care in Elizabethton says his practice is taking steps to limit exposure to potential COVID-19 patients.
We're trying to identify them at the desk, and then we're going to try to isolate them as far as either in the waiting room, not as a preference, but maybe even potentially in their vehicle so that they actually aren't in our facility at all.
Dr. Hoplin says that could include obtaining medical history by phone or taking samples from patients while they're waiting in their car. He says right now it's hard to identify who is actually infected or not.
Clinically, doctors are not able to distinguish mild cases from any other upper respiratory infection, and that has been the biggest problem we've had with this infection.
Staff at Doctors Care in Johnson City say anyone who may be experiencing symptoms should exercise caution.
For any patient who was immunocompromised or had, comorbidities, I would want them to be much more careful when coming in, call ahead of time. Do we have a lot of sick visits, things like that, just to be more prepared for our patients' safety.
Coronavirus tests are being administered through local health departments and the state lab. Dr. Hoplin hopes the FDA will soon allow commercial vendors to conduct testing.
Once that becomes available, doctors will be able to order a COVID-19 test like I can order a CBC or a basic metabolic panel that I order 20 times a day.
Blake Lipton, News Channel 11.